We all know how important it is to keep our own hearts healthy, but what about our pets? Here with all you need to know about heart disease and animals is vet Megan Alderson and Lucy Foster and Chico. Hi, Chico. You're sitting very nicely.
Looks like he's about to go to sleep. It's been a big morning for him.
Oh, that's so cute. Okie dokie. So, Chico has a heart condition?
Yes, he does. Lucy's got an interesting story. Like, Lucy took Chico on at what age, Lucy?
12.
Yeah, 12.
Okay.
So he was rehomed at 12. Lucy, bless her heart, had a friend that had Chico, and I'll let her tell the story.
Well, Chico's owner passed away a week after he handed him over. Chico, unfortunately, is more like a bit of a biter, and nobody would take him on, and so I offered to do this because I quite like the challenge of these little chihuahuas. And Chico at 12 was not very well when he came, but now later on developed a heart issue.
Yeah.
So what sort of heart issue has he got?
He's got a congestive heart failure. He's actually got a mitral valve problem, so his valves don't work properly. And when Lucy brought him in, I could hear a heart murmur, and progressively over the last couple of years, he's developed a pretty nasty cough. And yeah, so we're just babying him through to the end, aren't we?
Those are the symptoms, the cough?
Yeah, especially in small dogs. They're all different. So cats, small dogs and large dogs are all different when it comes to heart disease. So with the small dogs, cough. Okay. Yeah, that would be the first thing you saw, wasn't it?
Yes, it was a noticeable continual coughing.
Strangely enough, this is just happening to us at the moment too with my pussycat.
No.
But with him...
they don't tell you.
No, they don't tell you. And he's been eating beautifully and all of that, but he had this great big round belly, which I just thought he was healthy and fat and chubby and lovely. But I've been told is all fluid, and that's one of the things with the pussycats.
Exactly. So, you know, the heart's not functioning properly, so it's not getting rid of those fluids, and when that fluid, or, you know, it's wet, and it'll build up on the chest or the abdomen. So, in your case, the abdomen.
Okay, so treatment options.
Treatment options. So, basically, once we've diagnosed it, okay, and that's, we've got lots of tools to do that, we've got medication only, really. Surgery in some cases, very few in New Zealand. Oftentimes we'll have to go to the States to a cardiologist, a veterinary cardiologist over there for high-level surgery. And we've got a whole heap of medications here, and basically it's a cocktail which you'll probably recognise.
Yeah, we're on this one here.
And you're probably on this one too. Which is
diurin,
Yeah, absolutely. So we've got different medications depending on what stage they're at and what condition they've actually got, whether it's cardiomyopathy versus congestive heart failure versus what your cat's, which is ascites.
Okay.
Yeah, so different medications for different conditions.
What's the prognosis? How effective is the medication?
Again, it comes down to small breeds get congestive heart failure, and we can run those guys for 3 to 4 years. Okay, so they've got a good prognosis.
I understand dogs respond better than cats.
Yes, but cardiomyopathy, okay, which is dilated cardiomyopathy by the sound of your big heart. So you're seeing something like this on the screen, mostly a heart and no chest anymore. They've got probably a 3 to 6 months, and that's the same with large breed dogs. You know, so once we diagnose it in large breed dogs, you know, it happens suddenly, and you know they've got different symptoms. Oftentimes they'll just collapse, you know, in the park, have arrhythmias, and so do cats. And they're harder for us to manage. So these guys, you know, good prognosis. The other guys, pussycats and the large breed dogs, you know, we've got them for a period of time, but not forever. Yeah.
I'm thinking with the dogs, obviously don't exercise the cats, but with the dogs that you would take them for a walk, does that need to change? And
whoa, let's talk about that, Lucy. we advise lower exercise, but you know, in these little guys, what does he do on a daily basis?
No, he sleeps a lot, but he's impossible to keep calm because that's his way.
So he works at dog groomers, and he enjoys like meeting and greeting every you know dog that comes in there, and oftentimes that'll set off an attack, won't it? So we're just managing those attacks as they come.
Does the diet need to change too much?
Yeah, well, at his stage we do look at low salt. Okay, so low salt definitely helps with getting rid of that fluid, and you know it's probably not the end of the world if they have some, but you know that's about it.
Well, Lucy, thank you so much for bringing Chico in.
It's our pleasure.
You have a few more years out of him yet.
Yes.
I don't know if she needed it.
Anyway, go the meds. Coming up, Asta's getting a wee bit crafty. Yes, she is. And we are heading back to school with Michael Murphy.